I'm Cheryl Hamilton and one of the DBT therapists at Columbus Counseling Group. Um, I'm going to first do a little bit of an introduction and then we will jump into learning about dialectical behavior therapy. So as I mentioned, I'm Cheryl Hamilton and I am a therapist at Columbus Counseling Group. Columbus Counseling Group is a private practice in Columbus, Ohio. And amongst other things, we offer standard DBT. We actually have currently 7 therapists who've been intensively trained in DBT. And we typically have anywhere from about 6 to 8 DBT skills groups running at any time. So we have a pretty thorough program here at CCG, and we really pride ourselves in providing a program that is it's really true to the form of DBT that Marshall Linehan developed. Um, I have been with Columbus Counseling Group since 2014 and have been a therapist since 2007. I was intensively trained by behavioral tech, Dr. Marshall Linehan's company, in 2010, and I have provided both adult and adolescent DBT programs in both private practice, community mental health, and with juvenile probation. I also do a lot of treatment of trauma and dissociation, and am trained in EMDR and some different somatic modalities as well. So just to give you a little orientation to me and to the practice. So now let's go ahead and we will jump into the introduction to DBT. So here at Columbus Counseling Group, we really do try to provide not only treatment for our clients, but also education and support for their family members. This was something that I actually started back in 2016 when it just became so evident how helpful that was and how much so many of our clients' families were all asking for the same things. So typically what that looked like is clients' families wanted to know, first of all, what was this DBT program that their loved one is doing that is by most measures pretty intense for an outpatient program. And then they also wanted to know more about their loved one. They wanted to understand, for a lot of them, what's borderline personality disorder, and then also just a more general umbrella of what is emotional dysregulation. And so I started this just in our group room at Columbus Counseling Group of teaching. It was often spouses or partners and parents. Sometimes there would be adult children or siblings or friends that would attend as well, but just providing them that basic information. And this has really grown since then. We have our foundational programs, which this used to be included in the first class. So the first class was traditionally Intro to DBT and emotional dysregulation, but that just really overflowed. And so it made sense to add this information into this online course that you can, as you have, simply download and watch that. And then we've utilized really that full first class to jump into emotion dysregulation and really help put the pieces together for that and to really understand that. So in this first part, we're going to go ahead and look at, in a general sense, what is DBT? Well, let me jump back to this first slide here that gives the course overview. So this class, like I said, we're going to cover just the origins and the construct of DBT, where it came from and exactly all the pieces and parts to that. So you can understand if you're watching this as a treatment that maybe you're interested in, what to expect, or if you're watching this because your loved one is interested or is participating in DBT, to help you understand what they're doing, what that looks like. We will also ever slightly begin to build the foundation of the tools, the understanding, the skills for a healthy, fulfilling relationship with your loved one by introducing some of those DBT-based strategies. I assure you, though, too, the more that you understand DBT and just the basic assumptions, the approaches, the way that a DBT therapist would approach these problems, that is a building of the foundational relationship. Simply understanding those things is going to help with the relationship with your loved one who might be participating in DBT. All right, next slide here on what is dialectical behavior therapy. So first of all, DBT is the common name for this. This was developed by Dr. Marsha Linehan when she was out at the University of Washington. So it is a cognitive behavioral treatment. It was originally developed to treat chronically suicidal individuals diagnosed with borderline personality disorder. It is now shown to be quite effective in treating a variety of other disorders. It's primarily going to be treating disorders of under control, of dysregulation. So that's more like unstable, more out of control emotions. And we'll talk about that more in a minute, but that's what it has shown to be effective for. This could be different diagnoses. That could fall under some things under bipolar diagnoses, PTSD, ADHD. Yeah, DBT has been shown to be effective with that. Because again, those are problems where there's emotional dysregulation, there's impulse control stuff. So what happened though, this would be like in the early 90s when CBT was really the treatment that was more or less supposed to fix everything, right? So it's this idea of just change your thoughts and that will change your behaviors and life will be good. And honestly, for a lot of folks, CBT was super effective. It really changed so much. The problem was, and this is what Marsha started to see, is that there was a group of people where CBT was not working and it was actually making things worse, which is obviously the last thing we want to happen in treatment is for people to get worse. And by get worse, what was happening was there was actually more dysregulation. In a lot of cases, there was more like suicidal behavior, self-harm behavior, and or there was treatment dropout. So again, this is not what was supposed to be happening when CBT was implemented. And so what Marsha did was she started to really use analysis and her curiosity and go, okay, what's missing here? What's happening? And kind of to summarize that, what she determined was there needed to be more of a balance of acceptance and change. And that this idea of with CBT being too heavy on the change side, and it was too much for these folks that had significant emotional dysregulation. Again, it wasn't that the idea was bad, it was just that it was too much. It couldn't be implemented in an effective way. And so what Marsha did was she decided to add in mindfulness to balance things out. That was the avenue to balance the acceptance and change. And it was effective. And so that's how DBT started, and she developed the full program from that. DBT is shown to work pretty well for folks who have not responded well to other treatment. So a lot of times folks come into DBT have had a lot of other treatment. A lot of times that has included hospitalizations or what we call higher levels of care, IOP, PHP hospitalizations. The structure of DBT, the skills in DBT tend to be really helpful in laying a good foundation. DBT can also be a great like phase 1 part of trauma treatment. So it gives that stability, it gives those skills that a lot of folks move on. Either there can be an overlap, but also then go on to do treatment for trauma because they have the skills to tolerate distress, to regulate emotions. So DBT can be great for that. The goal of DBT is to build a life worth living. Marsha was really clear about this because she wanted to be clear that this wasn't just a suicide prevention program. DBT is designed to create a life that is worth living, that people enjoy and feel satisfaction, not just crisis stabilization. So I think that covers most of this first part here. Like it says here too, that focus on increasing an individual's ability to cope with, manage intense emotions, obviously a key piece with this. And that dialectic, I said that balance of acceptance and change, that is the core dialectic, and hence the name Dialectical Behavior Therapy. All right, we're just going to touch on this briefly, because the foundational one course is where we do that deep dive into these 5 areas of dysregulation and specifically into emotional dysregulation. But this does kind of answer this question of who is DBT designed for, like who participates in DBT. So when someone reaches out to us or is referred to us at Columbus Counseling Group for DBT, the first thing that we do is the assessment and pre-treatment phase. So the assessment is just a general collecting information, conceptualizing the problem, diagnosing, just like you would have an assessment anywhere. And then the pre-treatment phase is where we dive a little bit deeper because we need to see what's this looking like for this potential client in the 5 areas of dysregulation. These would match. So if somebody has borderline personality disorder, they're going to have symptoms or criteria in these 5 areas of dysregulation. That is not to say, though, that folks may not resonate or have a fair amount of dysregulation. Doesn't necessarily mean they meet all of the criteria to be diagnosed with borderline personality disorder. So hopefully that makes sense here. But when we're looking at participation in DBT, we're looking at these 5 areas of dysregulation. The foundational problem is going to be emotional dysregulation, but folks coming to DBT, they're going to have that as the foundational problem, but they're going to have dysregulation in typically the other 4 areas. So then DBT is designed to treat that dysregulation. Like I said, in the first foundational class, we dive into this and spend a lot of time with this. We're just covering it real briefly as our intro here. I wanted to talk with you real quick about the 5 functions of DBT. So again, this is Marsha Lenahan's work here of determining what does DBT do. First thing is it's going to enhance capabilities. There's a strong piece of our folks have skill deficits. And so skills need to be taught. They need to be practiced. They need to be reinforced. They need to be generalized. So this is one of the functions of DBT, is to enhance those capabilities through learning skills. The other is to improve motivation. This is through targeting, through behavior chain analysis, solution analysis. We're going to talk about that more here soon. The third thing is that DBT is also specifically designed to generalize skillful behavior skills to the client's natural environment. That's through coaching and also setting up practice in session and intentional generalization. Fourth thing is DBT helps to structure the environment to allow progress. Now, DBT is a consultation to the client model, meaning that the therapist works with the client to structure the environment. Now, what we're doing with family and education is, in a general sense, providing information, tools, and equipping family and friends to help with this piece of structuring the environment to be healthy and skillful, which is going to help the health of the family or the relationship or the environment there too. So we're kind of adding that in. I also offer family coaching. So in that sense, it's not speaking for the client, but it's adding a separate piece. Like I wouldn't do the coaching for my own clients, but it's adding that separate piece to help the environment structure. So we're kind of giving that added benefit. Last piece of DBT is enhanced therapist capabilities. That's primarily through DBT consultation group, but Marsha was really adamant of having that piece of of just this, enhancing therapist capabilities, that isn't just a kind of background piece that's central to DBT. We'll touch on that again here soon. All right, next slide here. So what does DBT teach? First of all, DBT is going to teach how to regulate emotions and behaviors in a variety of settings. And Marsha does use, as a true behaviorist, that term behaviors to mean both like actions, behaviors, cognitions or thoughts, and feelings or emotions, just to kind of clarify that. DBT also teaches folks how to experience a range of emotions and not act on them. So both of those things are very clear. A lot of times people think, when somebody has emotional dysregulation, that we need to work on just like decreasing the emotion. Not true. A lot of our folks are actually very skilled at restricting emotions sometimes, That is not what we're going for. We're not trying to like increase the frequency and duration of emotional restriction. That would be a problem. We actually need to increase the range and just like the healthy experiencing of the emotions. But the key piece there is not the impulsive piece. We don't want to act on those emotions. All that's taught in DBT. Third one kind of goes with that, how to decrease problem behaviors and increase skillful behaviors. So like we said, it is a CBT model. There is a behavior, Marcia's, a behaviorist. And so we're looking at decreasing behaviors that would be effective to decrease, increasing skillful ones. Fourth one is relationship improvement. So most, if not all, people coming to DBT, there's a strain in relationships because the emotional dysregulation, the impulsivity, all the symptoms that go with that are inevitably going to strain relationships. So that is a focus of DBT. All right. Let's look next here, as this next slide says, the components of DBT. So there's technically 4 components here, 3 of them that the client participates in. For it to be considered DBT, or some folks will say like an adherent or a standard DBT program, all 4 of these components do need to be present. That's because that's what the research is based on. So we need to be clear when we say somebody is receiving DBT, we need to be clear on what that is. First component is weekly DBT skills group. The function of this is to acquire skills. So again, the belief is that our folks have a skill deficit, and so therefore we need to teach skills. That is a separate component where learning is the focus. So it's not a process group that could be pretty dysregulating for a lot of folks who have significant emotional dysregulation. Then learning is not really going to occur so well. So that's why that's separate. Weekly skills group. Second one is weekly DBT individual therapy. This is where that processing is happening. That's where those skills, we don't have to take time then. I don't have to take time to teach those skills. That's happening in skills group. So in individual, we have this common language. We have a client who's building skills, and then I can work with them on implementing those skills. So like it says, it's an application of skills to their specific target areas, target behaviors. The last one is DBT phone coaching. This is the function of this is generalization of skills. This is where the client who's in DBT can reach out. I do a lot of mine by texting now, but they can reach out, text, call, however that's set up with their individual therapist for kind of in real time coaching for using skills. Again, that prevents things from like building up until the next individual session, potentially getting much worse, and helps reinforce that consistent skill use. The last one, I didn't put a number beside it, but technically the 4th aspect of DBT is that the therapists are in a weekly DBT consultation team. This is a required component. This is that consultation to the therapist that helps with things like fidelity to the model. It helps with therapist burnout, making sure that your therapist is able to provide the best quality of treatment. All right, let's look at the next slide here. So let's look at some of these components specifically. The first one we'll look at is individual therapy. This is a super key component of DBT. This is one of the things that Marcia obviously developed the DBT skills, but the skills themselves, some of them are pretty unique. Some of them are not necessarily unique. They're a comprehensive set of skills. That alone is not DBT. That's kind of become what a lot of folks are familiar with is the skills, but that's only a kind of small portion of DBT. Individual therapy, the implementation of these skills and the structure of how the treatment works here is super key. So in individual therapy, when I meet with someone again in pre-treatment, we're looking at a few things. We're looking at those 5 areas of dysregulation. We're also setting up our stages and targets of treatment. So this is very specific, and we'll go into more detail in a minute with this, but it's very specific of what those stages and targets look like. The diary card, that's also another piece of individual therapy we'll look at more in a minute, but this is the tracking of the targets and of skill use. The third piece of individual therapy is the behavioral chain analysis. This is the way that behavior is analyzed and kind of the method of behavior change. Let's look at stages and targets first. This is a sample. I believe this is Charlie Swenson's handout that he had developed many, many years ago. But here's a sample of what this would look like. If my client's in person, we would literally be having the paper out. If they're online, I'd be screen sharing, we'd be filling in the blanks on this. But this master list of prioritized treatment targets leads us down to the goal of a life worth living. That's another piece with DBT is we have specific life worth living goals that the client has come up with. Again, that goes to that belief this isn't like a suicide prevention program. This is actually building a life experienced as worth living. The first one, like I talked a little bit about here, is pre-treatment stage. The goal of pre-treatment is getting a commitment. Commitment to life, commitment to the treatment. We don't move on into DBT until we have that commitment. The way that is obtained, part of it is just orienting the person to the treatment. There's a lot to it. Can't really commit to something that you don't know what it is. So that's a little bit different as opposed to some therapies you kind of just kind of slide right into therapy. This is very specific. I'm sharing all the information. We're determining also, am I a good fit? Am I a good fit for my client? So we're going to be working together for a while. But that's the goal of pre-treatment. That is typically, it's getting the person ready for therapy. So we're getting all of, the treatment plan together, the diary card together, the commitment together, and then we are getting them into treatment. Typically, this is like 4 weeks. So 4 sessions, 4 weeks to accomplish this. Then we move into stage 1. So stage 1 is what you think of as like that active part of DBT treatment. This is also typically about a year. That's what the research would be based on. The goal of stage 1 is we are moving from severe behavioral discontrol or out of control emotions and behaviors to behavioral control. We want day-to-day thoughts, feelings, behaviors, interactions to be more in wise mind, more in the client's control, as opposed to dysregulated or out of control. That is the goal of stage 1. There's 4 targets under the stage 1. First is decreasing life-threatening behaviors. That's always the first target. On one hand, that can sound obvious, but you'll see here too, sometimes in some therapies, that is assumed to be the outcome, where in DBT, that is our first target, is we need to decrease life-threatening behaviors. That would include any suicidal urges and behaviors, as well as self-harm urges and behaviors would be considered a stage 1 life-threatening. We want to get those down. One of the things that comes up that's kind of important to point out too, that some folks don't necessarily think about is there's 2 aspects to life-threatening behaviors. One is the obvious lethality that we want to help people to stay alive and to be physically well. The other piece is that if someone is experiencing ongoing suicide and self-harm urges and behaviors, that's a super distressing way to that's going to interfere in a lot of aspects of life. And so it's super important beyond just a lethality piece, but it's super important to learn about what's happening there, analyze that behavior, and then ultimately work on decreasing that in an effective way, not just to trying to think how to explain that, but in a meaningful way. I guess that would be one way to put that, versus in like a punitive way, which is a whole nother thing to talk about with behaviorism too. And that is super important to DBT, is these things have to be done in the context of curiosity and validation. So it's not in like a punitive or simplistic way of just decreasing a behavior. That's not really going to be sustainable, and that would just feel pretty invalidating, frankly. So has to be done in the context of curiosity and validation. The whole treatment does. Second target, let's move on to the second one here. Second treatment target is decreasing therapy interfering behaviors. This is also something I think that's fairly unique to DBT to specifically outline this and identify goals for this. Couple assumptions here. One of, I guess the main assumption would be the behaviors that clients are coming to therapy for that are getting in the way of their life, those emotional and other areas of dysregulation, are inevitably going to show up in therapy. That if they're not, you would probably want to wonder about that as to why they're not showing up in therapy, because that would probably be a whole nother problem. That would be a whole nother problem. So we assume those are going to show up at least to some extent in therapy. In an attempt to then decrease kind of, how do we bring that up? Who brings that up? Trying to make that not shameful, all that stuff, we just lay it out at the beginning. So it's a very matter-of-fact, validating way of, hey, what behaviors do we anticipate coming up as therapy interfering? We don't really dance around this. We don't treat the client as fragile. We would just plan for this. And honestly, this approach works so much better when we're talking about it before it shows up. That way, when it shows up, it's just like, oh yeah, we anticipated this was going to show up. Now we will, use our skills. We'll analyze it. We'll do whatever to target it. It decreases shame so much. It also does a couple of things here. There's so much under this one. It helps folks to be aware of it. Sometimes, just being aware of something can help it decrease. The other thing is too, this is not only therapy interfering behaviors on the client's part, this is also on the therapist's part. So I would introduce it that way as well, so that clients can indicate either things they have noticed from me thus far, usually this is pretty early in treatment, or just in general therapist interfering behaviors that they are requesting that I be aware of that they've noticed has interfered with their progress in treatment. This also gives an opportunity for both the client and the clinician to normalize bringing this up. It gives clients a chance to practice interpersonal skills of bringing this up, making a request, basically tending to the therapy relationship, which is a super helpful skill of being able to tend to relationships. All right, next one. Target 3 under stage 1 is decreasing quality of life interfering behaviors. These are behaviors, pretty self-explanatory here, behaviors that the client is doing, thoughts, feelings, behaviors that are significantly interfering with their day-to-day quality of life, like with their functioning, with their ability to get their needs met, and function day to day in a healthy, effective way. This is where, like I mentioned a minute ago, some therapies will start here and assume that number 1 and 2 will go down. Like if we can improve somebody's satisfaction or contentment with life, then maybe their life-threatening behaviors will go down. Maybe their therapy interfering behaviors will go down. Sometimes that works. I'm not saying that never works, but there would be an assumption there that one has the insight and the skills to do that. When folks are coming to DBT with significant dysregulation, that often isn't the case. So as I mentioned, kind of with the whole development of DBT back when Marcia developed the treatment, was the problem, is CBT was starting here, and then number 1 and number 2 were actually increasing. This is honestly where we get a lot of referrals from folks who have done therapy with a therapist who's starting at 3, and then they go, oh, yep, this is not working. This person needs a treatment that is more specific to targeting dysregulation, like DBT. And so then it makes sense to go, okay, we need a different approach. Let's use this structured approach of DBT, and we go in this order. So that being said, though, once 1 and 2 are addressed, and that can be within a single session. So it could just be the order of this session, like we're devoting, say, half an hour, half the session to a number 1 target, and then the second half of the session to a number 3 target. So it's not like that has to be like, we can't get to that for a year or something. It's just that it always goes in this order. Um, and then the fourth stage 1 target is increasing behavioral skills. This is a primary focus in skills group. So that's why it falls to number 4 for the individual. So those are the 4 targets of a stage 1. Honestly, after doing this for like 20 years, it really matches up to the timeline. So a lot of folks, when they're coming in with true all 4 targets, it's about a year that you really start to see, I don't know if I want to say resolution, significant progress, like resolution on these stage 1. And it just feels like it really moves into stage 2. And that's not to say that's everybody's timeline. I have plenty of folks where it's a shorter timeline and we do move into stage 2 work, or it's a necessity to do some stage 2 work there too. So it's not like a one size fits all. Stage 2 work in the conceptualization of DBT here is the goal with stage 2 work is going from quiet desperation to non-anguished emotional experiencing. There's the assumption here, there's the need here that stage 1 work has to at least be fairly complete, because we have to have someone who has the skills to do this. This is a lot of trauma work. This is primarily done through exposure. So this is exposure. This could be somatic stuff. There's different modalities that do a lot of stage 2 work that are super helpful. So there could be like prolonged exposure, could do some EMDR, it could be like sensory motor, somatic stuff. There's different modalities, but the primary piece here is that there's going to be exposure. And so we want to help our clients be able to tolerate that through that stage 1 work before getting there. That's not to say there's no exposure. There's plenty of exposure that happens in stage 1 too. That would be, so again, stage 2, going from quiet desperation to non-anguished emotional experiencing. Stage 3 is not necessarily a therapy stage. This is going from problems in living to ordinary happiness and unhappiness. Things like improving self-respect, decreasing individual problems of living. Again, this could be through like supportive therapy, not necessarily. Stage 4, again, doesn't have to be a therapy stage. This is that like self-actualization kind of stage, going from incompleteness to freedom, to increasing that sense of freedom. And then the ultimate goal, life worth living. This worksheet, this structure is completed in pre-treatment and then obviously guides the treatment process. Let's look at this other piece that goes with individual too. This is the DBT diary card. There's a lot of different formats for this. Marcia had an original one that was in the book. There, the general things that we want on a diary card. Let's talk about that, and also the function. So the function of the diary card is a couple things. We want this to be observed and described non-judgmentally, so in our mindfulness, to the client. So this is helping our client to track those targets that they're wanting to work on. So the left side of the diary card is typically target behaviors. So like in this example, I think I have like problem spending, suicidal or distant behaviors, interpersonal dysfunctional behaviors, and alcohol use. Those would be specific to the person. Those are the 3 we'll say this person, this example chose. And then each day they would track actions and urges for that, typically rating those from 0 to 5. Right side of the diary card is going to have spaces to track emotions. So pretty standard diary card would have like angry, happy, anxious, sad, shame, guilt. So you're gonna be tracking those each day, again, using like a 0 to 5 scale. Some diary cards I've done have lying behavior as being tracked, some have physical pain, and then that last column is tracking skill use. There's the rating scale, several that I've seen have the rating scale at the bottom where you do that 0 to 7 of, did the skills come to mind? Were they effective? Did you use them? Were they helpful? That kind of thing. Most diary cards too also have the client track how often they completed it and their urge to quit therapy. These are things that we want our clients to be aware of in a mindful sense, where they're not over fixating on them, but they're also not restricting awareness to them. So if you think like healthy functioning people are tracking these things, they're not necessarily doing it on paper, and assigning a numerical value to it. But there's a flow of tracking this. So that's what we're wanting to happen with our folks in DBT is this is becoming a more involuntary, normal, natural kind of thing that they're aware of these things. The next step with that is, let's say somebody tracks a number that, like, say angry of 5, and they're like, oh, I would really like this to go down. We want folks to also then have that next step of, okay, what could I maybe do to get that down to like a 4 or a 3? So that would be the skills. So the awareness, the observation and description of the thoughts or feelings or behaviors or action or just then prompts that next step of skill implementation. Those are on the back of the diary card. Would be like a list of the skills. This one has then the days of the week. You can circle when you do them. That's also going to be skill reinforcement. So we're reinforcing using those skills. We're keeping the list of skills, the names of the skills on the radar as well. The other function of the diary card is it structures the session. So all of my DBT individual sessions, first thing we do is when the client comes in, I say, all right, let's look at your diary card. That helps us to know those targets. Do we have life-threatening things going on, therapy interfering, quality of life? Where should we start? How much time should we devote to things? That way we don't have to take 20 minutes verbally checking in about all of these things. The diary card, there's apps that folks can use that have this, that you can track it that way. I have some folks set up their own like Excel spreadsheet or like a fillable sheet that they can do. Whatever, I'm pretty lenient as long as it fits the general purpose and has these general components. Clients can do that however they'd like. The next thing to look at here is the behavioral chain analysis. This is the method of behavior change in DBT. So any behavior that we want to target, we can analyze that behavior. With DBT, any life-threatening, like suicidal or self-harm behavior is typically always chained. Other ones, there can be some flexibility with that. So when we say we're chaining a behavior, we're analyzing a behavior, what we're looking at, like you can see on this form, is we are looking at, okay, let's define that problem behavior. And again, this has to be done in the context of curiosity and validation. If this is done in a shaming way, or in just like a goal-directed way of like, we're not looking at with curiosity, we're just demanding that the behavior stop, that is not going to work. It's going to increase shame, probably, potentially increase restriction and not be sustainable. So it has to be done with curiosity and validation. That being said, so we want to look at like defining the problem behavior. We want to look at what were vulnerability factors, what were the links. So that would be like classical conditioning. What were the links leading up to this target behavior or problem behavior that we're trying to change? Under that, we want to look at, what were the consequences, both internal and external, operant conditioning. Understanding the behavior is so key. So we're understanding this behavior. Then you can see on the right side of this, what we want to look at doing is then a solution analysis. So we're looking at where could we possibly intervene? We could maybe intervene with like skill teaching. Maybe there's a skill deficit. We need a skill teaching. We need a plan for skill implementation. We can intervene by trying to decrease a potential reinforcer. We could look at like what's maybe reinforcing this. Could we change that? Could we move it above the problem behavior so that it's not reinforcing that? Maybe we could get the need met higher in the chain. We want to look at what things are conditioned. Could we maybe separate that out? Could we interrupt something that's being conditioned? Could we reduce vulnerabilities? Could we problem solve to change the prompting event? Again, we're entering with curiosity, we're entering with validation, we're running experiments. Basically, if we did this, would it change this? Try those things. We're planning for trying. We're not anticipating that we're like not going to do more chains. It's just, okay, next time we do a chain, let's kind of look what was different. What was different here? What worked? What didn't work? That is how we're looking at changing behavior in DBT. These, especially as we go on, or as it's not necessarily life-threatening, I don't always write these out, but it's always the method, it's always this idea of the curiosity, understanding the behavior, looking at ways for shifting, even if that becomes like less formal, more of just like a verbal conversation as therapy goes along. These are also things like we do together. I teach clients how to do them. They can do them on their own too. Next thing we look at, so let's look at the DBT skills part. So like we mentioned, we just finished talking about individual therapy. Those are all individual therapy things, the hierarchy, the DBT diary card, and then the chain analysis. So we're in transition over to looking at skills group. So again, remember, folks are going to a skills group once a week for the entirety of the DBT treatment, more or less. So typically about a year. We've got these 4 skill sets. Okay. So everyone is learning mindfulness, which is the foundational skill of DBT. This more or less is the prerequisite for any other skill anyway, of learning how to take in information and utilize information, both internally and externally, effectively. We also then teach, so mindfulness is 2 weeks, it's in between each module. We teach interpersonal effectiveness. This is basically learning how to increase getting your needs met in relationships without sacrificing the relationship and self-respect. It's kind of interpersonal effectiveness in a nutshell. We have emotion regulation. This is the biggest module. This is where we are teaching all about emotions, like understanding emotions. We're teaching about how to change or influence emotions. We're teaching about how to decrease emotional vulnerability to emotional dysregulation. Teaching distress tolerance skills, how to more effectively tolerate distress when it can't be problem solved so that we don't make things worse. Those are the 4 modules, the 4 skill sets in a nutshell. Group is super structured too. So group, like everyone comes in, they do mindfulness, we share homework. So there's homework every skills group. And then I, as the in skills group leader role, would then teach the next skill. Let me see where this, here's the old edition. So everyone has their skills manual. New edition just came out here too. So going forward, folks' skills manuals may look like this, but everyone has their skills book and there are handouts in there. There's worksheets in there. It pretty much feels like a class. We go through those. Everyone has a homework for the week, a worksheet where they practice the skill we went over. The point of it being so repetitive and structured is hopefully to not prompt a lot of intense emotions that then folks are spending more time trying to regulate the emotion and then harder for learning to occur. So hopefully that takes us to the end of our overview of DBT. Hopefully that answered some of your questions about what is DBT, who does DBT, where did it come from, what should I expect, what's my loved one doing. Again, this is a super introduction to DBT. So looking at your options for what's next. So if you are a potential client interested in doing DBT, you can reach out to Columbus Counseling Group to get started. There are several links on the website, columbuscounselinggroup.com, or you could call in, you can text in to get started with that. Easiest route to go is through the website. It can direct you with that. Again, columbuscounselinggroup.com to get started linking with us for treatment. If you're a loved one watching this, we have a lot of options for the what's next for you, for our family and friends education and support series. So the next thing, like I said, that this used to be a part of is the foundational 1 class. That's our our introduction to emotional dysregulation. That's where we're going to dive into those 5 areas of dysregulation. We're going to really dive into emotional dysregulation so we understand what that is, which on one hand may seem simple, but it's really not. There's a lot to that. And when folks understand that piece, that honestly helps the relationship a lot, because there's usually misconceptions about what that is, how it shows up, and also how it affects relationships. So we talk about that in the that class. I also teach the biosocial theory in the foundational one because that answers the question of how does this develop? Like, where does this come from? Which a lot of people want to know. How does either borderline personality disorder or emotional dysregulation or dysregulation in general, how does that occur? So we talk about that. We do go over states of mind. So I teach you that first lesson in DBT, the states of mind, the wise mind. That's pretty much the bulk of that foundation one class. It lays a lot of solid foundation. That in and of itself is going to help how you approach the relationship. I promise you, it will shift how you approach it. Even if it's not like a specific, like use this skill or say this thing, it changes the perspective. And we need that foundation, which takes us right into the second foundational class, which is the improving communication or improving the relationship with your loved one. That's where we're going to take all of that information from both this and the foundational one. And then we do get into more of the specifics. Big thing we learn in that is the skill of validation. That is often so misunderstood of what validation is. And it's key for any relationship. But when folks have emotional dysregulation, it is imperative and it's harder to do. So I will help you get some major improvement with your validation skills. We'll do I'll have some examples. We'll do some role plays if you want. No one's forced to do role plays. A lot of practice with that class. And then also if you do the foundational classes, you have access then to the monthly alumni practice groups that you can sign up for. And we have topics in those of just skill review, topic introduction, and then also practice where you can bring things that you would like for us to practice. The other thing that we do offer is a 6-week skills group for folks that is not a treatment skills group. This is just a 6-week introduction. Obviously, 6 weeks is so much smaller than a year. So we're only doing very quickly and just some basic introduction to some DBT skills. But family members, support people, having the skills is so, so important. DBT skills are essential really for everyone. They're essential for families. And so that can be a really helpful in pretty quick way to boost your skills that you can use really in any relationships. And then around holiday time, usually around beginning of November, I do a Cope Ahead for the Holidays one-time class that helps us look at some common stressors during the holiday and helps you prepare a Cope Ahead plan for the holidays too. I also offer individual coaching too. I say individual family where you or your partner family can come for coaching on your piece of more effectively interacting with, I hesitate to say helping, supporting, interacting with, improving the relationship with your loved one. It can also be informative. A lot of times folks will come for just informative about like, what are treatment options for my loved one, or what are levels of care, or what are places that are quality places, or what should I look for? That can also be a piece of scheduling a coaching session too. You can reach out through Columbus Counseling Group through those too. It can also, you can follow us, you can sign up for the newsletter, you can do that through the website. Columbus Counseling Group is on Facebook and Instagram. I am also on Instagram, Cheryl Hamilton, LPCC. My website either is or will be up and running soon, Cheryl Hamilton DBT. So those are all great ways to stay connected. Thank you for joining me today. And learning a bit more about DBT. I hope to connect with you soon.